about this. It's just speculation. But it could be that Nancy Pelosi is hoping something comes out of this that she can suddenly use
against Trump to say he's a provocateur. Well, that's what they're already saying.
They want something. That. Nothing has happened.
Well, you say they are possibly going to do a false flag incidents, which means...
Oh, red flag.
No, false flag. Which means that the left-wingers would shoot another left-winger and kill him, and then blame it on me or you or John or somebody and say, oh, he shot him.
This is apropos for today, Iran, what's going on. Trump did is amazing. It started off where he was very tolerant, very patient with the drone. When they attacked it, what else? Did they attack our military, militias or something?
We responded to their stuff. There were 5 militia groups that we targeted.
But that's after several things
they had
done over the past few months.
And then you move on and they staged this protest in front of the Baghdad embassy. The reason that the person, Soleimani, the head general, whatever, the reason he was there is because he was directing it. It's not a coincidence.
Well, I just heard on Laura Ingram's show last night or the night before or whatever, I was listening to it. She said that Trump had very good raw intelligence that said that Soleimani was working on taking the Baghdad embassy, and there's 16,000 Americans that work there or in and out between militia and people. That would have been horrible. And can you imagine if that would have happened? Then they would have blamed Trump for not acting enough. So he can't win if he does.
Well, Trump saved all those people, taking out the bad guy.
Well, and I did show you all this clip. We didn't put it up, but I did show you all this clip about Trump had already sent Patriot missiles. And he had sent those Patriot missile batteries over there under the premise that it was just training. And he got it in. It's probably not a coincidence that all those missiles didn't seem to hit anything.
The 12 missiles that Iran, you're saying that went over and to try to destroy us in Iraq. Actually, there are missiles that were supposed to be just going over there. They're the ones that countered and stopped them.
I don't have the statistics, but I believe that's what they did. No military commander is going to tell you everything. To say that Trump does not think these things through is insane.
To me, he had the intelligence. He connected the dots, killed the terrorists, and now we have one person, Soleimani, who is not revered around the world. Pelosi and all them are saying how horrible it was that we did this. How would she want to react if 16,000 people in our embassy there would have gotten killed?
Oh,
That was his next step. To me, I think they're un-American. And then for that one lady, Ilham, she said that she was just going crazy. She was just talking bad-mouthing our American ways. To me, she is just not. She needs to be taken out of office. Someone I hope can beat her. But to me, she's a traitor. She hates American ways. She backtalks America. She's a Muslim, not just a Muslim, but she backs up these terrorist organizations. What's the other one over there? Soleimani was the head of Hamas, Hezbollah, too. He was a part of all that.
And he was a designated terrorist, the Soleimani.
And even Obama did.
Yes, Obama had already designated him as a terrorist, so he did exactly the right thing.
For them to say that it was undue action, oh yeah, they were pointing it back to the Ukraine claim. Right.
I'm going to enter that because we've got very little time, but I was just going to say this. It seems that it's a very strange coincidence that the Ukrainian airliner was taken down, and our intelligence agencies say that it was probably 2 missiles that took it down.
Wow.
How much you speculate?
And you have all these democratic connections over in Ukraine where they've accused collusion, where they've made money and deals and back deals. I don't know what that really means, but
she doesn't look good.
It does not look good. Bad optics for sure.
Okay, I guess we're out of time. God bless you. Thanks for watching, and tune in again next week for the rest of the news. And John Brewer and Cindy Marlowe.
Miss Revere here. Who are you?
I'm just an average Joe.
Thank you very much, and tune in again next week.
Hi, I'm Dr. Frank Simon. I'm an allergist and family doctor, board certified in both allergy and internal medicine. I specialize in allergy, headaches, sinus, hives, cough, asthma, hypertension, and diabetes. We're located at 1404 Browns Lane near Norton Suburban Hospital. Our phone number is 895-5088. We can see you tomorrow.
Hi, this is Frank Simon with the rest of the news. We have two really special guests today. One is Angie Mangione, and the other is Sue Lee. Did I say that right?
You sure did.
Yes, you did.
Okay, now both of these people are affiliated with AMAC. Is that right?
That's correct.
So AMAC stands for, you tell me.
It's the Association of Mature American Citizens, and AMAC is the acronym.
Mature American Citizen, AMAC. Well, now, Andy, you're one of the key people with AMAC. Could you tell us a little bit about it?
Sure, I'd be happy to do that. I'm Senior Vice President for AMAC Action, which is the advocacy arm of AMAC. And AMAC was established in 2007 as an alternative organization for those Americans who are age 50 plus. We are the direct competitor to AARP, and we will tell you we are a right-of-center organization. Our mission includes the premise of faith, family, and freedom. We support smaller government, strong defense, religious freedom. We support the Second Amendment. And we built the organization into 2 million members. These are dues-paying members, Dr. Simon.
Beautiful.
It's not as if we're going to pull out an email list and call these people members. These are dues-paying members in all 50 states, including over 24,000 right here in the state of Kentucky, in the Commonwealth of Kentucky.
24,000. Now, I went to one of your meetings. I've been to 2 of them here in Louisville.
Thank you.
I was really impressed. The first meeting I went to, you were the speaker, and you were talking about safe harbor law and how it's responsible for raising the cost of medicines unnecessarily.
It's a fairly complex issue. What I was talking about in the meeting that you attended was the Medicare Anti-Kickback safe harbor that Congress instituted in 1987. What it does, it exempts group purchasing organizations and then later pharmacy benefit managers from criminal prosecution for taking kickbacks from healthcare suppliers. It was implemented in 1991, which allowed vendors and not hospitals to pay GPO, group purchasing organization, administrative expenses. Now, a group purchasing organization is responsible for the hospital supply chain. There are a handful of these GPOs that control all the hospital supplies inside a hospital. I'm talking everything from a cotton ball to a hip. When the safe harbor was implemented, the group purchasing organization's mission abruptly changed from reducing medical supply costs for hospitals to essentially becoming an agent of the vendors, and a pay-to-play situation emerged. What you have here is a situation where medical suppliers and drug manufacturers can simply purchase market share by paying these access fees to the GPOs. So you have these vendors that pay to access the hospital beds that these group purchasing organizations represent in the hospital supply chain. They're buying market share, and these fees are exorbitant. And these contracts are secretive, they're complex by design, and it's all perfectly legal, and it's driving up the cost of healthcare inside the hospital, and then on the outpatient prescription side with pharmacy benefit managers on the outpatient prescription drug supply chain, because the PBMs secured this same type of status in 2003. It's funny because the whole purpose of a group purchasing organization was to represent smaller hospitals, banded together, and they bulk bought hospital supplies. And for 80 years, this worked just fine. The hospitals were paying the GPOs an administrative fee to participate in the group purchasing organization, and it worked just great. But when the safe harbor was enacted, the whole dynamic changed, and the vendors began paying the admin fees, these access fees. And in 2003, pharmacy benefit managers were able to secure the same type of safe harbor status, and you have drug manufacturers paying pharmacy benefit managers to access their millions of insured lives. And these fees that these drug manufacturers are paying, they affect the list cost of drugs.
I remember when you gave that presentation at the AMAC meeting that it's raising the cost of medicines for me and Sue over here and everybody.
The Medicare program.
And that's why people go to Canada to get their medicines, because they're not under the same.
There's an unintended consequence. This system of pay-to-play is forcing firms to cease making inexpensive generic drugs rather than produce them at a loss. And on the hospital side, let's say you invented a pulse oximeter, really good pulse oximeter, and you did it in the garage and you're a brilliant engineer. Now, how do you bring it to market? You have to deal with these group purchasing organizations, and they say, fine, you want access to our millions of beds that we represent? Here's the fee to do that. And you're a one-man show, and you don't have that money, so you can't bring an innovative, less expensive new product to market because you can't pay the fee to play. So we're seeing a reduction in innovation. We're seeing drug manufacturers stop making cheap medicines because they can't access millions of insured lives because they don't have the money to pay the fee to do so. So what do we end up with? Single sourcing and artificial shortages. And we've seen that. A couple of years ago, we saw a hurricane hit Puerto Rico and take out a saline plant. Normally, okay, I'm sorry that happened. It wasn't a good thing. But that saline plant happened to be a sole source. And we saw a shortage of saline in the United States. Think about that, Dr. Simon. You're a physician. Saline, what is saline? It's salt water. We're a first world country experiencing a shortage of salt water. Emergency room doctors were pulling their hair out. They couldn't access saline because it's used in emergency cases because the product itself was sole source. It's just not me making this information up. We have government studies that show that these practices, in some cases, are responsible for these artificial drug shortages that shouldn't be happening in a first world country like the United States.
Well, Sue, what do you think about all this?
Well, I think it's horrible because I have a disease that is incurable, will never be cured from what I've been told, and I have to take a medication that's a biologic, which happens to be either a tier 4 or a tier 5 drug, which is very, very expensive. And Medicare passed legislation years ago where they will not negotiate on prescription drugs outside the hospital. They do for prescription drugs inside the hospital, but not outside. So now I'm on fixed income, and a lot of companies that offer assistance do not offer people who are on Medicare. Medicare, I can't get assistance because if you make $2,000 a month, they won't give you any assistance. At the time I found this out, I was making $2,024, and I wanted to ask them to take back $25 so they could help me with my drug. And what happened when I retired, I couldn't afford it. I went off of the drug, and I waited till my disease came back horribly, painfully. I can't even describe what it does to you. It controls your everyday life. It controls the type of clothes you wear. It controls the type of bedclothes you sleep in. It controls when you go out in public, you're embarrassed. There's a commercial that says, "See me," for plaque psoriasis. I don't want them to see me when my sores are visible. When they're on my hands, I would sit at meetings with my hands under the desk. And it's not just my disease. The biologics are used for Crohn's, for psoriatic arthritis, and my disease. All three of these diseases are incurable, and we are at the mercy of the drug corporations.
If I could jump in, I'm so sorry. There's a zillion stories like Sue's across the country. And I did want to point out with regard, you're a Medicare beneficiary, right? So I did want to point out, we talked about this a little bit, Dr. Simon. Last year, President Trump instituted or executive ordered what he was going to be, wanted HHS to enforce what he called a rebate rule. And he wanted these pharmacy benefit managers to share the rebates, or the access fees that I was talking about before, that pharmacy benefit managers receive from drug manufacturers at the point of purchase with Medicare beneficiaries like Sue. Now at AMAC, we want to see the complete removal of the middleman money. We're not saying let's get rid of GPOs. We're not saying let's get rid of PBMs because they clearly existed and performed a good service prior to this safe harbor, this anti-kickback safe harbor. So we thought that what the president was doing was a solid first step forward. If the money's going to be there, why not share it with Medicare beneficiaries? We're a 50-plus organization, so this would impact our members tremendously. We supported it. The GPO lobby and the Pharmacy Benefit Lobby and AARP did not. Okay?
Say that again. Who did not?
The GPO lobby, the PBM lobby, and AARP did not support the president's rebate rule. And the president ended up rescinding the rule. He has promised to revisit it after he's reelected. We look for number one, we hope and pray that he's reelected. And number two, we look for him to revisit this should that happen.
Yeah.
We're thinking to ourselves, now why would an organization that represents the same demographic that AMAC does not be in favor of having their Medicare beneficiary members receive a break for their out-of-pocket expenses at the pharmacy? PHRMA, it's an acronym, PHRMA, stands for the Pharmaceutical Research and Manufacturers Association. They're the trade group for manufacturers that make branded drugs. They commissioned an organization, Morning Consult, to conduct a survey of AARP members, and that explained in detail this rebate rule. And then they asked a simple question, do you support it? 86% of those AARP members that were surveyed supported the rule, yet AARP leadership did not. It's a head scratch.
I have patients come in several times a week that are trying to get asthma inhaler to prevent asthma returning. Almost all of those asthma inhalers are $300 a month to use them. And there are very few people that can do that. The insurance company in general won't. They may cover part of it, but there's a lot like $150 a month that would be out of pocket.
Are these older patients, doctor?
A lot of them are.
Right. On a fixed income?
Well, I have a son who is asthmatic, and one of his inhalers, out of his pocket, they wanted over $600. He makes good money. He wouldn't do it. And that's when you talk about how little the amount of that drug is in that bottle. It's a sin.
It's definitely a concern. It's a big concern. Right now, AMAC members are involved in a call to action, and they are reaching out to Health and Human Services. Again, this is acting on President Trump's executive order for transparency, price transparency. HHS is asking for people to comment on the president's executive order that would require hospitals to reveal their secret negotiated prices with insurance companies and also their cash prices. So this would give people, regular people listening to this program, the opportunity to see the prices before they have a service performed. And they can shop it much like they do everything else. Buying a car, buying a house, buying groceries. Price transparency leads to competition, and competition lowers healthcare costs. It does. We're about to have another critical discussion on healthcare reform. The Affordable Care Act is dying a slow death. Circuit Court ruled that the individual mandate was unconstitutional. Law itself is on the respirator, fading. We're about to have another critical discussion on healthcare reform. And the president has done 3.5 years he's been in office, has done so much by executive order to strengthen Medicare. AMAC was at the Villages in Florida, I believe it was October 1st last year, when he was in a small hall announcing his executive order to strengthen Medicare, to increase the amount, make more available, more Medicare Advantage plans to give people more choice. What we find with AMAC, our members want to make their own decisions, be in control of their health care. They don't want to be told what to do and when to do it. They want to be informed. So please tell me what's going on, and then I will make a decision. This is a very personal choice, and they want to make it. Give us the information, and then leave us alone.
People are saying, well, just give me a prescription. I'll send it to a pharmacy in Canada and get it for half of or less than what I can get it for in the United States. And a lot of people are doing that. I don't know if it's legal or not, but they're kind of got their back against the wall because these prices are so outrageous. Right. And it brings up the question, why can you get all of these medicines for a half or a third in Canada, but not in the United States?
That's a really good question. You also have to wonder where Canada is getting these medications. Where are they coming from? Third world country. You have to take that into consideration. But let me talk about the savings that could be realized by repealing the safe harbor, GPOs and PBMs. If you repeal the safe harbor protection that allows these group purchasing organizations and these pharmacy benefit managers the opportunity to collect money from the vendors that they contract with, if this is repealed, what it would do is open up the drug and medical supply chains, or hospital supply chains, free market competition, and foster innovation. And it's been estimated that the healthcare in general, we're talking the hospital supply chain and the prescription drug outpatient supply chain, you're looking at about $100 billion in savings. That includes savings for the Medicare, Dr. Simon, and these estimates were calculated through an analysis of government data, empirical studies. These were empirical academic studies and savings achieved from off-contract pricing. And you also have to factor in the effects of new competitive products. The potential is there. Is it the answer? No, it's not the exclusive answer. Is it a giant step? It's a $100 billion step in the right direction. Do you think that would impact everybody who goes to the hospital or who goes to the pharmacy to pick up their prescription?
I remember when you gave this presentation a few months back, and somebody asked you a question, well, why don't they repeal this? And you said, these middlemen are making lots of money,
Billions.
and they pay it to the congressman re-election, so the congressmen don't want to vote against them.
It comes down to dollars and cents. AMAC is part of a coalition of physician and patient advocates, and the main goal is to reform healthcare. These folks put out a white paper, and part of the white paper is repeal of the Medicare Anti-Kickback Safe Harbor. We're not alone in here screaming and yelling. What we have found when we talk to people on Capitol Hill, the GPO lobby and the PBM lobby is very strong and it's very well funded. These members of Congress are contacted. They could be harassed by the insurance lobby, the GPO lobby, the PBM lobby, the hospital association lobby. They want to keep everything status quo, keep the money flowing, and they are well funded and make big dollar donations. So the money is used to sway these people to stand down. People are outraged, they'll be harassed. There'll be an attempt to see how malleable they are in terms of changing their mind and how much money can be thrown in. Nothing illegal is going on here, Dr. Simon.
Because they're campaign contributions.
Yeah, it's exactly right. We're talking billions of dollars are at stake here. So you can see the Herculean effort that's being made to keep the status quo. But you remove this middleman money. We'd like to see it removed completely. Minimally, the estimates are $100 billion in savings to hospital supply chain, outpatient prescription drug supply chain, including Medicare and Medicaid. Great place to start, don't you think?
Now, Sue, what do you think? What do you think that repealing that safe harbor law would do for the cost of your medicine?
Well, they take out the middleman or men. Sounds like there's more than one. It should be a significant savings. But also, I think a lot of people don't realize when Andy was talking about savings, what I don't pay for my drug, Medicare pays. That's taxpayer money that's going to these drug corporations.
Yeah.
And that's just not fair to the taxpayer. There's a lot of them. I'm fortunate. I am healthy. I take no medication except a biologic. How fair is that when I spent all my life paying into it and now my government, they're through with me and I have to pay these big bucks to stay pain-free and be able to wear my clothes in comfort and to be able to go out in public and not worry about maybe one of my sons getting this disease because they say it's genetic. You have financial advisors tell you to plan for your retirement. You plan for your retirement. You have this money in a savings account and bonds and money mutuals, but guess what? If you try to get assistance, they tell you, oh, you can't get it because you can afford to pay for this drug. Save all your life and you invest and then you get a disease you can't do away with, can't get rid of. It's there and you drain your savings before you can get assistance.
Sue is where the rubber meets the road. Same thing in your practice, Doc. You guys are living with this every day. This Medicare Anti-Kickback Safe Harbor has created a system where purchasing agents and not physicians typically decide which drugs, medical devices physicians can use for their patients, based largely on how much kickback revenue these products can generate for the GPOs and the PBMs. So there's no incentive to keep costs down. And in some cases, some hospital executives receive what they call sharebacks from these companies. And they include these sharebacks, which are financial, into their overall compensation. So where is the incentive to control costs? This is a beautiful, wonderful country we live in, only in America. How many times have you heard a statement start off with only in America?
Right.
Only in America can somebody, a brilliant, obscure engineer, come up with a medical device, and he's got it now. He or she, their hands are tied to get this product to market.
Right.
Because there's a person, there's a middleman who does no R&D, who doesn't distribute, who doesn't manufacture, that's in the middle of that potentially innovative, low-cost device accessing millions of Americans with their hand out, collecting a fee.
Terrible. I've often wondered, why can you get the same medicine in Canada for half the price or a third of the price? Just much, much cheaper. Why do Americans have to pay these huge prices when nobody else seems to have to pay them? Am I saying that right?
Yeah. You're looking at a different system up there. You're looking at socialized medicine. Somebody's paying.
And they get to negotiate.
The people are paying in one way or another through high taxes. I'm not defending the Canadian system. Everyone has a story. Everyone knows someone that has accessed medicine outside of this country. Why should that happen? The bulk of the research and development is done in the private sector.
Here in America.
Exactly right. And you do have the federal government doing some R&D, but by far, the vast amount is done in the private sector. And this is why, when you look at what's going on in Congress, all the impeachment nonsense aside, Nancy Pelosi's H.R. 3, the drug bill, her plan to lower prescription drugs, is a price fixing for pharmaceuticals and will kill research and development. And any time that price fixing has occurred throughout the world for pharmaceuticals, it led to rationing. This is their solution to lower drug costs. There's got to be a better way. Why don't we take a look at this Medicare anti-kickback safe harbor? How about starting there? $100 billion in savings, lower the drug costs. There's other things to address too. Again, I can't stress enough that this isn't the end-all, be-all, but man, it's a wonderful place to start.
Patent law, when pharmaceutical companies abuse the patent laws to keep other drug companies that can't make generic medication
at a lower cost.
At a lower cost. So why not work on that too? The company that makes Humira, I don't know if I'm allowed to say the company's name, but they were one of the biggest abusers of patent laws nationally and internationally. Our government set the laws. It's not illegal what they're doing.
No.
But it's not right.
This Medicare anti-kickback, what these organizations are doing is legal. Today it's legal. But in any other business where you take a kickback, it's not. Where you take a kickback in a pay-to-play scenario, you're breaking the law.
I think AMAC is doing a great job for having you spill the beans on all this corruption. I think that's tremendous. That's important for people to know because everyone is affected. Like Sue or me or anybody listening to the program, we're paying through the nose for some of these medicines.
Healthcare is one of the top concerns for our membership, and that's all-inclusive. That's high insurance premiums, high deductibles, high drug costs, high costs for procedures, out-of-pocket expenses. It's everything. We work very hard. We're very fortunate. We have a full-time presence in Washington, Dr. Simon, and we do have a seat at the table for healthcare reform. We're grateful for that. As I mentioned before, AMAC is part of a coalition of patient and physician advocates. Well, guess what? We represent the patient advocates because we've got over 2 million of them as our members.
See, that's great.
Look, it's wonderful to do this kind of work. We have to generate results.
Now, if somebody wanted to join AMAC, they go to www.amac.us.
Exactly. AMAC.us, AMAC.us, or they could call 888-262-2006. It's a toll-free call, 888-262-2006, and they can sign up online or sign up over the phone.
And you just now, within the last year or so, got a chapter in Louisville.
Yes, we opened up our Louisville chapter. We have a physical presence on the east end on Shelbyville Road. Opened that up in April, occupied it, started holding meetings in May. We have monthly meetings and sometimes more than monthly meetings there to service our AMAC members in the local area. Just in Kentucky 3 and Kentucky 4, those congressional districts comprise basically the metro area. We've got about 7,000 AMAC members in that.
Well, that's great.
We're everywhere.
I know. I really appreciated the meeting. Okay, so this is Andy Mangione, Sue Lee, about out of time. So God bless you, and tune in again next week for the rest of the news.